Wake up in the morning, sun shining bright. Got my coffee brewing, everything feels right. But there's something special that I can't deny. Bougie, confident boss lady, she's the reason why. Serving wisdom fresh, like it's made to order. On the Shift Happen podcast, she takes across the border. From hustle to flow, her vibes never fade. She's dishing out the truth in an A-list parade. Shift happens, baby, don't you miss the beat.
Well, hello there, my mighty shifters. This is Corrina Jackson. Real talk, real impact. I am your bougie, confident boss lady coming to you with another episode of Shift Happens, where we take real talk and turn it into real impact. See, today we're going to be talking about something that should shake you to your core. I know me being in this business for 30 years, it still shakes me to my core. Why are babies dying? With all this top-notch medical technology and top-of-the-line healthcare system, why are babies dying? And I know that sounds harsh, painful, and even scary. I don't know the pain as a personal story, but I sure can tell you that I've been around those clients, those loved ones of mine who have lost babies and witnessed the pain, and it never lessens. I mean, you can never measure grief. You can never put a timeline on how long someone should grieve a baby's loss. In this business of saving lives, you witness lives you don't get to save. And we can't ignore it. It won't go away. And until we look it dead in the face, babies will keep dying and families will keep hurting. Let's just pause here for the cause. Death is never easy. And let me be crystal clear. All babies deserve a chance at life. I've heard some harsh remarks when babies die. I don't understand people sometimes. They come up with things that just really don't make sense. Like, she should get over it easily. The baby only lived for 1 or 2 days. Or he should get over it easily. Pain never lessens. It never goes away. Triggers can come in every and any type, shape, or form. And those triggers alone can bring on unwanted pain. So today we're going to be talking about the numbers and the heartbreak, the barriers and the hope, because I believe hope always deserves the last word. We're going to be breaking this up in 6 parts. The first part is Tulsa's hidden crisis. Let's talk about the numbers here in Tulsa, because I have to make this real for you. Now, I want you to picture a room full of 200 newborn babies. Now, imagine 8 of those babies never making it to their first birthday. That's the reality here in Tulsa County, where the infant mortality rate is 8 per 1,000 live births, higher than the national average of 5.4. And some zip codes in North Tulsa have a rate of 10, 11, and 12 per 1,000 births. And I've actually seen those numbers as high as 22 per 1,000 back in 1996. And right now, Black babies are dying at an all-time high of 16 to 21 per 1,000. Those are just not numbers on a spreadsheet. These are tiny caskets, little bows and barrettes, funeral programs with teddy bears printed on the covers, mothers and fathers standing over graves with empty arms and shattered hearts. You see, guys, I've held those mothers. I've cried with those families. And I'll never forget a mom who whispered to me through her sobs, looking me dead in the eye and saying, I did everything they told me to do. Why did my baby still die? That brings me to part 2. Why are babies dying? So why are babies dying in Tulsa and across the country? Here's what the data tells us. Premature and low birth weight. About 1 in 10 babies in Oklahoma is born too soon. And premature babies often struggle to survive. Birth defects. Some conditions happen early in pregnancy, sometimes before the woman even knows that she's pregnant. Unsafe sleep. In Oklahoma, more than 1 in 3 infant deaths during the first year are sleep related. That means babies suffocating in beds, on couches, or under blankets. Maternal health, conditions like high blood pressure, diabetes, infections, stress during pregnancy put babies at an all-time risk. Lack of prenatal care. Women who don't get into prenatal care are 3 to 4 times more likely to lose their baby. The truth is still this. Some communities face more barriers. They have fewer hospitals in a rural area in Tulsa. Areas around us are maternal health deserts, meaning that they don't have hospitals or places to actually go and have their babies. They have to drive to the next county to have a baby. It's ludicrous, really. Fewer doctors who look like them and less trust in a system that hasn't always treated them right. And here in Tulsa, they're still costing babies their lives. That brings me to part 3, the faces behind the numbers. I want you to remember something. Behind every statistic is a baby with a name. Like baby Jackson, born at 24 weeks, fighting for every breath in the NICU unit. Or baby Amaya, who died in her sleep because her mom was exhausted and was too scared to ask for help and fell asleep with her in the bed in her arms. Or the mother I met at Hillcrest Hospital who came in too late because she couldn't find a ride. Devastating, y'all. These babies and these families, they deserve better because all babies deserve a chance at life. Now that brings me to part 4 of this episode, the good work of Healthy Start. That's not a miracle. It's a community in action. Really, it is. Now let me tell you where there's hope and where hope shines through the darkness. I've worked in maternal child health for more than 3 decades. I've seen communities come together and make a difference. One of the brightest lights in the fight is Healthy Start. And right now we're fighting to keep this program funded. The stats are that this program makes the difference. They're there. And it is much needed. That's what the stats are telling us overall. But we have a U.S. administration right now that says eliminate Healthy Start, eliminate the funding. They want to see it go away. And for what reasons? To cut the budget and to save money. Remember, I'm talking about lives here. Here's what Healthy Start does right in Tulsa. And because we have 115 projects across the United States, they're all different according to the needs of our community. So as you can see, this program is so important to the community because it looks at what the community's needs are and it shapes its efforts around what the community needs. Healthy Start helps pregnant women get into early prenatal care, even if they don't even have any insurance. It connects families to transportation, housing, mental health services, and food resources. Let me say this about Healthy Start. It is building the necessary pieces and the bond with the families. When I do my presentations, I like to refer to Healthy Start as a program that recognizes the Maslow's hierarchy, and that says you have to address and define the basic needs before you can even get to the problem that exists. And when I say that, I talked about connecting these families and all of that because that's the defined needs that need to be addressed before you can even reduce the stressors that may be a huge risk in the baby having a healthy outcome. Also, Healthy Start teaches safe sleep practices. It offers home visits, support groups, and classes for both mom and dads. It helps to reduce stress by being a soldier to lean on and an ear to listen. Healthy Start is saving babies' lives every single day. And we have the numbers to prove it. In neighborhoods where Healthy Start operates, infant death has dropped by 30% over the past decade. It's not a miracle, it's a community action. Which brings me to part 5, how SHIFT is stepping in. And that brings me to what SHIFT stands for, supporting healthy initiatives for Tulsa. At Shift, we're stepping in where the gaps are biggest. We're helping families who have no transportation to prenatal appointments, don't have enough food on their tables to nourish a healthy pregnancy, feel lost, scared, or judged when they walk into a clinic, need education on safe sleep, breastfeeding, postpartum depression, and more. Want fathers involved, but don't know how to bring them in. And that's why it's so important for Healthy Start to talk to the fathers. We have father lounges to talk to fathers about whatever is going on in their lives that could affect them knowing how to co-parent or knowing where they stand with child support. How do they earn their rights to even see their child once the baby is born? Healthy Start does all of that. Shift isn't just talking about it. We're doing something about it. Let me tell you a little bit about Shift Healthy Start, if you will. We served over 700 families last year, and we provided over 2,000 rides to medical appointments, helped secure housing for more than 40 pregnant women, and held over 150 safe sleep trainings in our communities. Partners with churches, schools, local businesses, and spread life-saving information throughout our communities. Because Shift, we believe that even small actions can save a baby's life. That brings me to part 6 of this episode. Mighty Shifters, I want you to remember this. Every baby matters. Every baby deserves a chance at life. So if you're listening to this right now, whether you're a mom, a dad, a grandma, a neighbor, a friend, here's what you can do. Encourage prenatal care early and often. Learn safe sleep rules. Check on the pregnant woman. Check on the father. Check on the family, because there's a support system to the pregnant woman. Spread the word about programs like Healthy Start and agencies like Shift. And never be afraid to ask questions or speak up for yourself or your baby, because Shift believes we can change the story from babies dying to babies thriving. We are Tulsa, and together we can shift the bad into good. And if you're listening from another state or another country, get involved if infant mortality is high in your state or your city. I challenge you to learn more about infant mortality, get involved, and do your part. This has been another episode of Shift Happens with Corrina, your bougie, confident boss lady. I'm going to ask that you like, subscribe, and share this episode. This is real talk, real impact. And always remember that I am your morning snack, your noonday nibble, and your evening unwind. This is Shift Happens. Let's keep fighting for the chance of every baby, because every baby deserves a chance at life. Until next time, bye for now.